for accepting this webinar as a speaker. And for all of us, we just want to understand who our speaker is. So certainly, Professor Izema has a very rich experience as far as the Department of Animal Health and Productivity is concerned. He is also heading the Faculty of Veterinary Medicine from the University of Nigeria. As far as his career summary is concerned, he has an outstanding animal health and production specialist with 13 years of experience as far as the field practice is concerned. Also, he has a rich experience of 25 years in the field of teaching, research at university level. He has accomplished various lectures as well as a researcher. He has a very prominent. He is a personable animal production academic that inspires students, livestock farmers, and stakeholders for for engaging them for proper managemental aspects as well as the productivity, how to increase the productivity of animals. Evenly, he has long life experience for scholars and learners, which he is doing doing his daily activities for empowerment of animal health in Nigeria. And with this webinar, certainly he will be reaching to the world. So I welcome Professor Chuka Izema, and thank you, sir, for accepting this webinar and guiding all of us for this important topic of inflammation and its association and its impact on animal production. Sir, over to you, sir.
Okay, thank you, Doctor. Welcome all the participants. I most humbly welcome you to this knowledge sharing forum. Like the chief host has said, it should be reasonably interactive. So I'm just going to lead the discussion. And at the end, I'm going to leave the floor open for people to make their inputs. As he rightly introduced, our topic is inflammation and its impact on animal production. And of course, my background is Department of Animal Health and Production, Faculty of Veterinary Medicine, University of Nigeria, Nsukka. So we start the discussion by attempting to answer a question as to what is inflammation.
Sir, sorry. Sorry.
Hello?
Yet your screen is not visible, sir. Yet your screen is not visible.
That the screen is not visible?
Yeah, sir. Yes, the screen is not visible.
Okay.
Yeah, now screen is visible, sir. You can start.
Is visible now?
Yes, sir. Sir, I'm so sorry. Our participants cannot speak because this is the webinar platform. So only speakers can speak. But if they have any questions, they will add in question and answer session, which I will be as a facilitator, sir.
Okay. So I said we'll start with trying to answer the question, what is inflammation? Inflammation is the immune system response to stimuli such as pathogens, damaged cells, toxic compounds, or irradiation. It functions by removing injurious stimuli and initiating the healing process. Inflammation performs its functions in four major ways. It prevents initial establishment of infection or remove damage. It prevents the spread of infection or repair damage. It recruits effector cells if the immune cells of the innate immune system cannot control infection or repair damage. It also mobilizes effector cell, that is T and B lymphocyte, to the site of damage or action. Inflammation is therefore a defense mechanism that is vital to health. What causes inflammation? That should be our second question to attempt. Most common causes include pathogens or germs like bacteria, viruses, or fungi. External injuries like scrapes or damage through foreign objects or trauma. The main three benefits of inflammatory response include: one, prevent the spread of damaging agents to nearby tissues; two, dispose of cell debris and pathogens; and three, set the stage for the repair process. The next important question is to try to distinguish between infection and inflammation. Infection is caused by microorganisms, while inflammation is one of the responses of the animal to the pathogen. However, inflammation is a stereotyped response, and therefore it is considered as a mechanism of innate immunity as compared to adaptive immunity, which is specific for each pathogen. So the inflammatory response is characterized by 5 cardinal signs. Number 1 is pain, 2 is heat, the other is redness, the 4th is swelling, and the 5th is loss of function. In some cases, there may be no symptoms of inflammation at all. That is what we call subacute inflammation. What are the dangers of inflammation? Left unaddressed, chronic inflammation can damage healthy cells, tissues, and organs, and may cause internal scarring, tissue death, and damage to the DNA in previously healthy cells. Ultimately, this can lead to the development of potentially disabling or life-threatening diseases. Let's look at the relationship between inflammation and nutrition. There have been this question as to, are they friends or foes? Inflammation has been identified as the key driver for disease-related malnutrition, leading to anorexia, reduced food intake, muscle catabolism, and insulin resistance, which are a catabolic state. When chronic inflammation occurs, an animal's feed intake decreases, meaning they will be less productive. The animal also diverts nutrients from their performance in an effort to address the inflammation cause. This shows a development. This slows development, reproductivity, and negatively affects overall being. You see, the truth is that once there is an inflammatory response, there's a kind of emergency in the animal's entire metabolic process. And the emergency is to go and attack or arrest whatever is causing the inflammation. While that is going on, other productive functions suffer. How does the inflammation cause malnutrition? Inflammation contributes to malnutrition through anorexia, with reduced feed intake, as well as through tissue catabolism, leading to muscle and fat wasting. What are the impacts of inflammation on animals? It is confirmed that inflammation is a major threat to profitability and animal welfare. Inflammatory reactions are decisive factors in everyday life of the livestock. Elevated stress and inflammatory risk activate the immune system, not only weakening the animal health and well-being, but also expending additional energy. In the case of cows, for instance, this could be to the tune of more than 1 kilogram of glucose per day. This energy is solely missed by animals, not only when they produce milk, but especially in critical periods. A particularly critical one, when cows essentially have a negative energy balance, is during calving. If they have to expend additional energy on immune defense at such a time, they will lose body fat and put their liver and immune system under threat. This has far-reaching implications that go a long way beyond calving. Literature shows that in some cases, as much as 40% less energy is available for subsequent milk production. So there's a loss of up to 40%. However, the clinical symptoms of such inflammations, such as ketosis, reduced fertility, and loss of performance, often go unnoticed. Also, inflammatory parameters are not always obvious. Therefore, the easiest parameter to assess or to use to determine how inflammation can affect animals is by assessing their performance. Cows were considered to have had inflammatory disease if they were diagnosed with those factors that affect the uterus, which include retained fetal membranes, metritis, that inflammation of the uterus,
I guess we lost you, sir. Hello.
inflammation is necessary
Sir,
for
sorry.
life and
Sir,
is
sorry.
the first step in the healing or repair process.
Professor, sorry, we lost you for a few seconds. Can you just repeat the point, please?
Hello?
Professor,
Inflammation.
We lost you for a few seconds. Please repeat the point.
Hello? Inflammation is necessary for life and is the best step in the healing process or repair process that help the body to fight off bacteria, pathogens, and their toxins and repair damaged tissues. If you ever twisted your ankle, been stung by an insect, or cut your finger, you may have experienced firsthand the familiar sensation of pain, redness, swelling, and heat that result from an injury or infection. This is inflammation in action. While an appropriate and robust inflammatory response is necessary, excessive or prolonged inflammation can become detrimental if not controlled. For purposes of practical animal production, inflammation is divided into two categories: the acute and chronic. The acute inflammation is the first line of defense to a pathogen or injury. It's a short-term process where the immune system sends white blood cells to the site of the injury or invasion of the pathogen to initiate the healing process. This response should be rapid and robust, preparing within minutes or hours following activation of an immune response. On the other hand, chronic inflammation occurs when the immune response fails to eliminate the cause of the immune response or acute inflammation. Chronic inflammation can last for weeks, months, or longer. It diverts nutrients away from growth, reproduction, and production in order to fuel the fight against the inflammatory response. This is where it negatively affects production in livestock. Risks and costs of chronic inflammation. Livestock and protein producers need to pay close attention to inflammation and immune systems. While inflammation is necessary, there's a trade-off in terms of animal performance. It helps them to remain alive, but they pay by reduced productivity because the nutrients they should have used to grow or produce is dissipated in trying to combat the inflammatory agent. When an animal is sick, its feed intake will decrease. At the same time, the immune system redirects nutrients utilized for growth to protection during an acute inflammatory response. When the immune response persists and chronic inflammation occurs, nutrients and energy are diverted away from animal performance, including growth, reproduction, feed efficiency, and meat or egg production, ultimately decreasing profitability. Let's briefly examine the immune system in action. The immune system is comprised of a sophisticated network of cells, proteins, and enzymes that are programmed to monitor animal wellness. This network of cells detects and respond to bacteria and pathogens that may invade the body, as well as response to stressors, injury, or environmental challenges. All of this can have a detrimental impact on animal wellness and performance. When a pathogen or bacteria crosses one of the body's barriers, such as the skin, mucous membrane, or blood vessel linings, the immune system will detect the invasion. The immune system then sends signals to cytokinins, pro-inflammatory proteins, indicating that help is needed. This initiates movement of white blood cells toward the site of inflammation, infection, or trauma. The first responders to the site are white blood cells called phagocytes. These cells help protect the body by ingesting harmful foreign particles, bacteria, and dead or dying cells. There are two forms of phagocytes. The first being the neutrophils, which are small granular leukocytes that quickly appear at the site of a wound and ingest bacteria. The second being monocytes, which are larger leukocytes that appear about 3 days after infection and scavenge for bacteria, foreign particles, and dead cellular material left behind by the neutrophils. The neutrophils appear at the surface and work to engulf and destroy the pathogen or bacteria. They then displace species of the pathogen on their surface to signal the monocytes to help continue the attack on the invading pathogen. There are also a group of anti-inflammatory cytokinins that help control the pro-inflammatory cytokine response. However, if there is a lack of balance between the pro-inflammatory and anti-inflammatory proteins, the pro-inflammatory cytokinins can send too many monocytes, that the white blood cell, to the site, damaging healthy cells and leading to chronic or prolonged inflammation. If this prolongs for a long time, it can lead to what we call autoimmune reactions. This is the point when the acute inflammation response can potentially turn into a chronic inflammatory response. Let's look at common sources of inflammation. There are several common sources that impact livestock and poultry performance and profitability. The two most common sources are poor gut integrity and heat stress. The GIT lining serves as an important barrier to prevent bacteria, pathogens, and their toxins from passing through the intestinal lining and into the bloodstream. When a breakdown in the barrier occurs, this can lead to a condition called leaking gut. When a prolonged inflammatory response occurs in the GIT, this decreases feed intake and animal performance. Let's look at the impact of heat stress. When animals are under heat stress, blood flow is diverted away from the tissues that line the blood vessels within the digestive tract and other internal organs to the skin. which facilitate the heat dissipation process. However, the reduction in blood flow causes decrease in the amount of oxygen and energy available to the epithelial layer of cells lining the GIT, allowing pathogens and other toxins to enter the bloodstream due to leaky gut. Production challenges caused by inflammation. A few common results or consequences of inflammation in livestock and poultry include decreased skin, carcass, and meat quality, as well as decreased food pad integrity. These production challenges involve an immune response. Left uncontrolled, this immune response can lead to chronic inflammation and diseases such as foot rot. The skin or epithelial tissue function as a protective armor against inflammation. From maintaining strong skin and foot pad integrity is a critical means to help prevent scratches and infections that can result in chronic inflammation and potentially lead to carcass condemnation. The typical cattle that has undergone a lot of chronic inflammatory reactions. Let's look at the impact on reproduction. It is critical for production animals to mount an effective immune response following the betting process in order to effectively eliminate pathogens that enter the reproductive tract during the betting process. It is also important to repair epithelial tissue damaged during betting to replace those with healthy epithelial tissue in order to help prepare the animal for subsequent pregnancies. While this process is necessary, prolonged or chronic inflammation can result in decreased reproductive performance. For dairy cows, particularly those in pre-pasteurization period, it is important to avoid or reduce as much as possible any kind of infectious parasitic.
Professor, sorry, we again lost you for a few seconds. Can you just repeat your point, please? Can you start with this slide? Hello.
Inflammation can.
Hello. Yeah, we are sorry. I guess there is some network issue, so that we cannot
make our performance by lowering milk yield, driving.
We are so sorry. I guess there is some network catch from Professor Sets. He's just rejoining. He is just rejoining. We are just rejoining. Sorry, there is some power failure, so that they lost the Wi-Fi connection. So they are just trying for alternate arrangement. So we are so sorry. But certainly this topic is very important, and doctor was focusing that inflammation, it's not only for the related with the swelling and everything else, but it has a tremendous detrimental impact on the productivity. So certainly as a professional, we are using anti-inflammatory drugs. So that's how we have chosen this topic, because since this topic is very, very important, we have choices for antibiotics as far as the system is concerned, but we don't have that kind of choices for NSAIDs or the anti-inflammatory drugs. So this was the motto where we can, have more focus, because antibiotic we can use anything, but for especially the NSAIDs or especially the anti-inflammatory drugs, we should be very selective while using, and it is mandate to certainly use NSAIDs depending on the situation, certainly. So that's why we have chosen this topic to talk on. So just because of the technical glitch, professor, couldn't join. So he's just joining back again. So there was some internet issue, electricity failure was there, and that's why he couldn't get the Wi-Fi connection. So he's just joining. So I just expect yours as usual support. So sorry for it. So soon he is joining, and we again can enjoy the session. If you have any questions, meanwhile, please feel free to, you can drop your questions in question and answer. So we will just try to attend all these things within the stipulated time. So thank you so much for your support. And I would like to request all of you, if you have any question or any query pertaining to the topic, please feel free to discuss that question and answer panel. We are again so sorry. On behalf of, again, I want to welcome you on behalf of Ashish Life Science for this knowledge gaining webinar. We are so sorry for this, unavoidable circumstances where there is a power failure in Nigeria, but still professor is trying to join us as early as possible. Our Dr. Chibuze is there with the professor, so he is assisting him to join back at earliest. But thank you so much, all of you, for your support. Yeah. Meanwhile, I will just a few questions are there. Thank you so much, Professor. There is one comment from Lydia. Thank you so much, Professor. I would like to know much on the pro-inflammatory and anti-inflammatory things. So surely, Lydia, we will address this question. I will assist to discuss with Professor. And there is one more question from anonymous attendee. He or she doesn't want to, disclose the identity. The question is: apart from getting inferences from blood counts, that is the type of inflammatory cells like neutrophils, monocytes, or anyway DLC in circulation, how do you determine if an inflammatory is acute or chronic, especially when it is not observed by physical examination or just on tentative diagnosis from performance indices? So surely, Mr. or Miss Anonymous, we will try to address this point once Professor is back. And एक hands up आहे बघ कोणाचा hands up. Okay, he just did that. So please feel free to mention your points in question and answer. So we will try to address those once Professor is joined. Will be back. And thank you for having that patience and your support to Ashish Life Science. Certainly, as an initiative of knowledge sharing, we will continue these kind of webinars to uplift the knowledge of veterinarians as well as the farmers. We are expecting soon Professor to join. Dr. Chibuze is helping our VSM. He is helping him. So soon he will be back, and we will again enjoy the session back. Thank you everyone for your patience and your time. Yeah, Dr. Edward, thank you so much, because this anonymous is Dr. Edward. He just texted me that this is Dr. Edward. So I guess by mistake it has been shifted to anonymous. So no issues, Dr. Edward. We will address your question. Yeah, Professor is joining from another network. So meanwhile, we can just again add if some few questions. There is one question from Dr. Darius. Thanks, Professor. Would like to know if there is any importance of use of probiotics and antibiotics in chronic stage of inflammation. So certainly, Dr. Darius, we will escalate the question to Professor once he is back. Soon he will be. So we will address this question. But meanwhile, guys, you can just we can utilize our time and we can just discuss if you want to put any question or any of your query in question and answer session. So we will try to address those once Professor is back. And I am so sorry, since this is a webinar platform, only the panelists can speak in this one. So, but no issues. You can just post your questions in question and answer session tab. So feel free if anything is there. We all are professional colleagues. So we will try to address one more again from the anonymous attendee. Request a repeat on the point regarding poor gut integrity as a source of inflammation. Yeah, surely we will try to address that point again. I will request to Professor to repeat that point. And again, on behalf of Ashish Life Science, I would like to extend my gratitude and thanks to all of you. And I can see now Professor has joined back. Professor, can you hear us? Professor Chuka? Can you hear us? Professor, can you hear us? Hello? Professor, are you able to hear us?
Yeah.
Okay.
Sorry.
No, as you can understand, the bandwidth is very low. So you can switch off your video, no problem.
Okay.
Okay, but we will not be able to see your slide. Can you just put it on the and share your screen?
Yeah, we are trying to do that.
Yeah, please share your screen so that we can see the slides.
Enable me. You have to enable me again.
Yeah, now you can see. You can add.
Okay. Why should I miss it? Stop the video first. Okay, let's do this thing right. Why is it finding it difficult to share?
Are you able to share now, sir?
No, we're still working on it. Yeah.
Dr. Chibuze, what is the issue?
No, we are trying to share.
Okay. Okay.
Yeah. Just give us some few minutes.
Participants in the closed caption. We are connected to.
Professor, meanwhile, they can connect. There are few, questions. So we can just quickly answer those questions. Meanwhile, once Dr. Chibuze can connect the presentation or share the screen. there is one question from Lida that he's extending you the thanks.
Well,
Thank you. And can you just help to understand on, or you can
okay.
throw some
Yeah.
light on pro-inflammatory and inflammatory things? So can you clarify what exactly is this pro and anti-inflammatory? So pro-inflammatory and anti-inflammatory, the differences between that. So you wanted more clarity on this.
Oh, thank you. The pro-inflammatory are those processes or factors that will help or initiate an inflammatory response. And those are the stimuli. But anti-inflammatory are those processes that will now try to arrest the inflammatory response. And these are the immune system response. So the immune system responds to arrest the inflammatory process, while the pro-inflammatory initiates the reaction.
So, sir, nutshell, if
Yes.
you allow me,
What I have.
is it the same that pro-inflammatory means like
Sorry.
these are the inducers of inflammation, and anti-inflammatory means
No, yeah, yeah, the pro is in support,
yes.
but anti is against. Yeah.
Yeah, perfect.
So those things that promote it are pro, but those factors that try to arrest it are the anti.
Thank you, sir. Hope.
And in the body system, that is the duty of the immune system.
Yeah. So thank you, Professor and Lydia, for taking us to this direction. One more question is there, sir. That
yes, sir.
Apart from getting the inferences from blood count directly, because if suppose at the field level, blood count is a bit troublesome job. So depending on the facilities available there. So is it anything that we can determine if any inflammation is acute or chronic when it is not observed physically? Is there anything tentative diagnosis? Like we can see some performance indicators of animals, so we can just judge whether the inflammation is acute or chronic. Is there anything that we can diagnose?
Yeah, in some specific cases, like
Sir, sorry, we lost you again.
well, the is a typical inflammatory reaction. So, you are not hearing me?
No, now it's okay.
I said, okay. So, like in a myositis situation, which is a typical inflammatory reaction, what the easiest diagnosis is the white blood cell count in the milk. Once the population is more than 200, the milk is condemned. So the assessment is from disease, it varies from disease situation to the other. In some situations like lameness, you notice it by reaction of the animal. The gait of the animal will change. The steps, if you compel it to move, will be different. And these are signs that the animal is experiencing some pain, either in the leg or some other place.
Sir, sorry, but the question is towards like how we can identify the inflammation is acute or the inflammation is chronic. Is there any performance, indices or indicators where we can judge?
Yeah, in terms of performance, what you notice in terms of performance is generally there's reduced performance. If it is a milk yielding animal, there will be fall in milk production. If it is a growing animal, there will be reduction in weight gain. These are performance indicators.
Sir, how we can differentiate between acute inflammatory
that
condition
some
and chronic?
inflammatory reactions are taking place. And well, it is easy to differentiate acute inflammation from chronic. Acute inflammation is a matter of hours, and it is normally associated with, in most animals, increase in body temperature. High fever is one of the cardinal signals that there is an acute inflammation. It may not be the only cause of high fever, but it's one of the major causes. But in chronic inflammation, you may not pick such a high temperature, but you will notice the protracted effect on production. So while you can assess chronic through the production performance indicator to detect acute is by taking the rectal temperature of the animal.
Okay, sir. Sir, thank you.
So I think we are back. We can continue now.
Sir, sorry, your slides, your screen is yet not visible. Please share the slides with me. I will try to share the screen from my end. And there is one more question.
Hello?
Yes, sir. Please share
It's
the
not
slide.
visible.
I'm not able to, we are not able to see your screen.
Okay.
And there is
Okay.
one more. Yeah, now we can see your screen, sir. Now we can see
You
your
can
screen.
see it now. Okay. Okay.
Yes, sir.
So we can.
Sir,
Yeah.
sir, please, you can start.
Yes. The next slide. Yeah, the next slide we wanted to discuss is the situation with the dairy cow.
Sir, just hold on. Sir, sorry, just hold on. There is one point that the poor gut integrity as a source of inflammation. So can you start your slides from there?
From where?
The poor gut integrity was there.
Okay, poor gut integrity.
Yeah, please, you can start the presentation from that slide.
Okay.
So your slide is not moving.
Go, poor gut integrity. Go back.
Yeah, there was some slide with the leaky gut. Yeah, from here,
Okay.
so you can start.
Yeah. Wait, we are past it. Okay. Yeah. Go back again. Is that okay?
Yeah, please, you can start from there.
Okay. We're trying to say that the acute inflammation is normally the first line of defense to a pathogen or injury. It's a short-term process where the immune response system sends white blood cells to the site of the injury or invasion of the pathogen to initiate the healing process. The response should be rapid and robust, appearing within minutes or hours for the activation of the immune response. On the other hand, chronic inflammation occurs when the response fails to eliminate the cause of the immune response or acute inflammation. So when the acute phase fails to arrest the invading pathogen or injury, the chronic phase sets in, and chronic inflammation can last for weeks, months, or even longer. The ugly thing is that it diverts nutrients away from growth, reproduction, production in order to fuel the fight against the inflammatory response. Because the inflammatory response is at an energy cost, is a nutrient cost. And those nutrients used to do the battle are lost to productive process. The risk cause of chronic inflammation. The livestock and poultry producers need to pay close attention to inflammation and the immune system. While inflammation is necessary, there is a trade-off in terms of animal performance. When an animal is sick, its feed intake will decrease. At the same time, the immune system redirects nutrients utilized for growth to address the acute inflammatory response. When the immune response persists and chronic inflammation occurs, nutrients and energy are diverted away from animal performance, including growth, reproduction, feed efficiency, and meat egg production, ultimately decreasing profitability. So with that background, we're trying to see the immune system in action to understand how this response takes place and why it has to cause some nutrients. The immune system is comprised of a sophisticated network of cells, proteins, enzymes that are programmed to monitor animals' wellness. This network of cells detects and responds to bacteria and pathogens that may harm the body, as well as respond to stressors, injury, or environmental challenges. All of this can have a detrimental impact on animal wellness and performance. When there is a particular invasion through the skin or the GIT or the lining of blood vessel, the immune system will detect the invasion. The immune system then sends signals to cytokines, pro-inflammatory proteins that help is needed. This initiates movement of white blood cells towards the site of inflammation or trauma. The first responders to the site are white blood cells called phagocytes. These cells help protect the body by ingesting harmful foreign particles like bacteria, tissues, dead tissues, or dying cells. There are two forms of phagocytes: the neutrophils, which are small granular leukocytes that quickly appear at the sites, and the second being monocytes, which are larger, that appear 3 days or more after infection and scavenge for bacteria, foreign particles, and their cellular materials left behind by the neutrophils. The neutrophils appear at the site first and work to engulf and destroy the pathogen or bacteria. They then display pieces of the pathogen on their surfaces to signal to monocytes to come and continue the attack on evading pathogens. There are also a group of anti-inflammatory cytokines, like the interleukins 1 and 6, that help control the pro-inflammatory cytokine response. However, if there is a lack of balance between pro and anti-inflammatory proteins, the pro-inflammatory cytokine can send too many monocytes, that's the white blood cells, to the site. And this will result in damaging healthy cells and leading to chronic or prolonged inflammation. This is the point when an acute inflammatory response can potentially turn into a chronic inflammatory response. We're trying to look at common sources of inflammation. There are several common inflammation sources that impact on livestock performance and profitability. But the two most common sources are poor gut integrity and heat stress. The GIT lining serves an important barrier to prevent pathogens and their toxins from passing through the intestinal lining into the bloodstream. When a breakdown in the barrier occurs, this can lead to a condition called leaky gut. When a prolonged inflammatory response occurs in the GIT, this decreases feed intake and animal performance. The second source is heat stress. And when an animal is under heat stress, blood flow is diverted from the tissues that line the blood vessels within the digestive tract and other internal organs to the skin, which facilitates the heat dissipation process, because the animal is trying to lose heat by in the process of thermoregulation. So the flow of blood is diverted from internal organs and GIT to the superficial blood vessels under the skin, so that the animal will dissipate more energy to the environment and remain cooler. However, the reduction in blood flow to the GIT and internal organs causes a decrease in the amount of oxygen energy available to the epithelial layer of the cell lining the GIT, allowing pathogens and their toxins to now enter the bloodstream due to a leaky gut. The point we are trying to make here is that when there is this diversion of blood flow away from the GIT, it will consequently lead to a leaky gut. And once the gut leaks, then these pathogens and toxins can now gain entrance. And that initiates an inflammatory reaction. The production causes or consequences that result from inflammation. A few common results or consequences of inflammation in livestock include decreased skin, carcass, and meat quality, as well as decreased food pad integrity. These production challenges involve an immune response. Left uncontrolled, this immune response can lead to chronic inflammation, such as foot rot. The skin or epithelial tissue function as a protective armor against inflammation. Maintaining strong skin and foot pad integrity is a critical means to help prevent scratches and infections that can result in chronic inflammation and potentially lead to carcass condemnation. As we go along, we take a closer look on the effect on this integrity of the skin, as we are going to look at a typical case of foot rot. This is a typical case of an animal that has gone through a number of inflammatory reactions and is now suffering from chronic inflammatory state. You can see the loss of body condition. In fact, the animal is just battling to remain alive. Let's look at the situation with reproduction. It is critical for production animals to mount an effective immune response following the birthing process in order to effectively eliminate pathogens that enter the reproductive tract during the delivery process. It is also important to repair epithelial tissues damaged during delivery and repair with healthy epithelial tissues in order to help prepare the animal for subsequent pregnancies. While these processes are necessary, prolonged or chronic inflammation can result in decreased reproductive performance. This can come in many ways. It can delay initiation of estrus, and of course, that will prolong your calving intervals. Let's look at the situation with dairy cows, particularly those in pre-pasture period. It is important to avoid or reduce as much as possible any kind of infections, parasitic or metabolic diseases, and the association inflammation. Such inflammation can impair cow performance by lowering milk yield dry matter intake, fertility and energy efficiency, and can reduce liver functions. Mastitis in cattle. Bovine mastitis is an inflammatory response of the other tissue in the mammary gland caused due to physical trauma or microorganism infections. It is considered the most common disease leading to economic losses in the dairy industry due to reduced milk yield and poor quality of milk. And cows that suffer from mastitis, not only that the milk production is poor, is reduced, the quality is poor because of the high white blood cell count and high condemnation. Lameness in cattle. Lameness is the expression of pain. Cattle behave similarly to humans. The pain causes them to lie in store for a long time and off feed. Ultimately, the well-being and the health status of the animal is compromised, along with production losses. Lameness is generally considered to be the third most economically important health diseases in dairy herds after fertility and mastitis. Worldwide incidence is reported as high as 26% of all dairy cattle, with a much higher incidence in high-producing dairies in temperate countries. This is a typical case of skin challenge, ulcer in the foot, sole ulcer with granulation tissues protruding from the damaged chorion. This is a typical example of loss in the integrity of skin that announce a penetration of pathogen, and we can see the consequence. Foot rot. Foot rot is a highly contagious disease affecting the digital space, that is between the toes of ruminants. It is one of the most common causes of lameness in cattle and sheep and can be of serious economic loss. Once present in the head flock, foot rot can be very difficult to control. It is known to be a very ubiquitous health condition because the causative agent is difficult to eliminate. Prioritization of nutrients. This is a very silent aspect of impact of inflammation. As we tried to say earlier, when there is an inflammatory process, the animal prioritizes nutrients, first of all, to address the inflammation so that the animal will remain alive. If it doesn't control the inflammation, it will die. Trace minerals and vitamins are found in the diet in small quantities, but they have a considerable impact on reproductive performance and many other biological functions. Zinc is involved in over 300 enzymatic activities required for the structural and functional integrity of over 2,000 transcription factors, and is involved in almost every signaling and metabolic pathways of metabolism. The priority for trace minerals in the diet of livestock are needed, integrated during process of inflammation and enzymatic activities, followed by maximum reproductive performance and high milk production. Amino acid pathway and consequential inflammatory reduction is important as a metabolic process and a utilization of feed. Nutrients are limited based on the nutrient load of a diet and feed intake. The nutrients must therefore be prioritized to meet the specific needs of the animal. Sows prioritize nutrients and energy for metabolism, lactation, growth, and reproduction due to the short duration intervals of a sow's lactation, as we try to show in the figure below. If you look at this figure, nutrient prioritization in first priority sows, maintenance takes the highest, because it has to spend energy in respiration, circulation, excretion, all that to remain alive. The next highest is lactation. It must produce enough milk to be able to sustain the large number of piglets. Pigs give large litter size. The remaining is for the growth, and then the left and the least nutrient left is for reproductive performance. These are the other priorities in a sow. Nutrient partitioning of production priorities. However, if one examines the priority of dairy cow, there will be some differences due to the number of lactation days. Researchers prioritize the metabolic use of energy for dairy cows, ranking each physiological state: basal metabolism, activity, growth, energy reserve, pregnancy, and lactation. Additional energy reserve, estrous cycles, and initiation of pregnancy and exogenous reserves. This creates a conflict in terms of reproductive function due to compromising minimum energy reserves and the need for high milk production. Let's closely look at the interaction between inflammation and cytokinins. And I think that may throw more light on the question you asked about pro and anti-inflammatory. The hidden culprit in nutrient utilization in high inflammation is inflammation. It is fingered as the culprit in nutrient deficiencies for production, because it shuts away what should have been used for production to arrest the inflammatory response. It is therefore important to consider the role of inflammation to protect livestock from chronic inflammation that can be detrimental to the animal due to the continuous release of cytokinins. In simple terms, anything that causes cellular trauma, disease, or injury, as well as any kind of stressor, can cause inflammation. Pro-inflammatory signals, that is cytokinins. Of course, they are the things that are sent forward to recognize a pathogen or injury or stressor. Cytokinins are small proteins molecules that can cause a strong stimuli, which marks the inflammatory response. These signals will reach the brain, which tell the body that something is wrong. The brain will release corticotropin releasing factor, which will stimulate the adrenal glands to release corticoids or stress hormones. Its role is to alter nutrient utilization, and this provides energy and a different cascade of amino acids for the immune system to function. At the same time, there is concurrent effect on the performance of the animal, because as it tries to shut down the insulin growth performance and of regulating acute phase protein for the immune system, the release of corticoids allows the immune system to heighten its priority for use of nutrients to resolve the inflammatory problem. Each type of stress may have different releasing factors and process to heal it. Heat stress decreases blood flow to the intestinal tract, we have said earlier, and lowers nutrient supply to the enterocyte. As the respiration rate increases, it creates a more reactive oxygen species, ROS, which can damage the protein stitching in the tight junction. Protein stitching in the tight section is the sign for building of body tissue. This allows harmful substances from the intestinal tract to enter the bloodstream. In response, pro-inflammatory cytokinins are released, which elicit an immune defense. look at the influence of nutrition on inflammation. Ovaries in livestock species can impact by lipopolysaccharides. They can be impacted by lipopolysaccharides due to gut leakage, E. coli in drinking water, and LPS derived from inflammation in the uterus. This inflammatory response impacts the hormone output from ovaries. This is due to the granulosa cell detecting the LPS, which then shuts down the anti-enzymatic pathway and convert testosterone to oestradiol benzoate. Girls or sows that have this have very poor response to estrous stimulation by boas, and they are therefore problem breeders. When this response happens in sows, that may lead to what we call silent heat. So the animal may come on heat and it will not be detected, and it passes on. And this is a very negative impact on general productive performance of the animal. Common result or consequence of inflammation in livestock and production. They include one, decreased carcass and meat quality, decreased reproductive performance, and decreased lameness. These production challenges involve an immune response. Left uncontrolled, this immune response can lead to chronic inflammation. The greatest impact on reproduction is when livestock are dealing with inflammatory responses. This translates into a much poorer reproductive success. Reproduction is not only a luxury, but a vital part of the production that determines the success of any livestock venture. Inflammation has been described is like a thief in the night that reduces reproductive performance. However, all these alarms we have tried to raise about inflammation, both acute and chronic, there's a good news, because the ALS Life Sciences have, through rigorous research, produced a good product that can effectively control the inflammatory processes in our livestock and checkmate them and prevent them from causing damages that will lead to reduced production, specifically reproductive performance and integrity of both gut and skin. And the name is Melovin. It is also called Meloxiclash. These are just different names of the same active ingredients. The name varies from country to country. If you're in Nigeria, I think we have it as Melovin, but in some countries, they have it as a Meloxiclash. Recommendation. Yeah. Recommendation. Based on the facts and research findings as elucidated above, it is therefore recommended that in the management of bacteria, maybe in the case of mastitis or foot rot, or viral or fungal and parasitic diseases in sheep, cattle, goat, pigs, and horses, Melovin or Meloxiclash should be incorporated in the treatment regimen to minimize the consequent inflammatory reactions and prevent negative impact on productive performance of the animal. Melovin or Meloxiclash functions to 1, increase milk yield in dairy cattle, 2, improve reproductive performance, and 3, weight gain in livestock through suppression of inflammatory responses such as pain and fever, and efficient utilization of nutrients. Thank you for your audience.
Please, if anyone has any question, please feel free to discuss that.
Let me have writing material. Let me have.
Dr. Chibude.
Yeah.
Yeah, I have sent yesterday the pack shot to professor. Can you just show those this pack shot? In his presentation, it's already there.
Okay, so his mail.
Yeah.
Okay, send something to your mail.
Okay. Pictures. Okay.
Yeah. Few questions are there now, guys. Please feel free. The topic is open for discussion.
Just you can confirm.
Okay.
Professor, they want just you to focus more on
Yes.
effects of inflammation, please. Can you just repeat the effects of inflammation?
The inflammation, the effect on what?
Overall effects.
Well, the overall effect
is
very important because one is that it divides nutrients that should have been used for productive purposes. Because once it happens, it's an emergency. The animal will stop every other thing it's doing to battle the inflammation. It gets worse when it becomes chronic. Because if it becomes chronic, that means that this wastage of nutrients will last for a long time, and the animal will now suffer from a lot of production losses. This normally affects the reproductive system most, because it will, like we saw in the case of the sow, those reactions can cause heat to be unnoticed. When you have silent heat, it's a loss to the farmer, because if the farmer fails to breed the animal when at the right onset of estrus, he waits to another estrus to come, feeding the animal and wasting his resources. So the greatest effect is, first of all, on nutrients, because it diverts the nutrients which should have been used for production to fight the inflammation. The second major effect are those specific effects on those animals, especially in dairy. Once a dairy animal have mastitis, which is a classical case of inflammatory reaction, the milk yield is reduced, the milk quality is poor. So the farmer loses both sides. Another major impact is because it damages anywhere there is a crack, either in the skin or in the gut. If it happens in the skin, that will lead to, especially if the skin is around the foot area, that will lead to lameness. If it happens in the GIT and it causes a leaky gut, that will lead to a barrage of inflammatory reactions. The sum total is reduced productivity.
Yeah, thank you, doctor. And there is one more question.
Yes.
Certainly, see, it is found that the anti-inflammatory drugs causes. There are few cases that I don't know, Diogres, where you found this, that why most of NSAIDs causes abortion. Because see, I guess if Professor Izima can throw some light on it, that abortions in anti-inflammatory or drugs.
Yeah, it could be a contributory factor to abortions, because you see, when there is inflammatory reactions, the animals stop every other thing. If the nutrients are diverted from maintaining the uterus and the embryo, depending on the stage of the pregnancy, the animal may have to abort the fetus to keep itself alive. It's a defensive mechanism. So, and that is one of the consequences of chronic inflammation. Because animal must battle it. If it can't control it, it will consume the animal. The animal will die. So if shedding of the embryo or the fetus is the last option for the animal, it will drop the fetus to remain alive.
Okay. And most of the time we have seen that when you are using steroidal anti-inflammatory drugs, so their chances of abortions are more as compared to the non-steroidal also. Right, Professor?
Hello? Come again.
Yeah. See, the chances of abortions are more in steroidal drugs rather than the non-steroidal.
Well, the non-steroidals are safer.
Yeah, non-steroidal are more safer in case of pregnancy.
Yes,
So I don't know when Dr. Dugres has comment, but no issues. There are few questions that can we use meloxicam in dogs and cats? Certainly, meloxicam is recommended in dogs and cats also, so we can use. Sir, one more question is there from Desta. As you indicate, the importance of meloxicam is very important manner. Should make it available, giving as free gift. Certainly, Mr. Desta, we have a plan of meloxicam. Unfortunately, I don't know where exactly you are from which location. So certainly, we have our people across the various geographical locations. So we are doing the free samples, evenly the advertising, and we have the veterinarians only on the field, so they are discussing about meloxicam and they are advertising it. Also, one more question is there, sir, from the anonymous attendees. Okay, it is the same, Mr. Desta, the same question. Okay, the same question is, I guess, repeated. Okay, pattern poultry, if you are different products. The question is from Mapenzi again, that he is asking, patterning poultry has a few inflammatory products on the market. I have only came across those containing sodium salicylate. I would like to know if there is any with different activities that can be used. Mapenzi, I think you need to elaborate the question, because the question is not, very well explanatory. So we will take it later on. One question is there from Akabu. Good day. Please emphasize more on how it's been observed in poultry. So can you just throw some line on role of anti-inflammatory or inflammation in poultry, Professor?
Yeah, you discouraged our including some slides on poultry.
Yeah, but see now
food path dermatitis is a big problem in poultry, especially in parent stocks, where you have to have hairy males that can mate the females. If you have a problem of food path dermatitis, it will result in reduced fertility and hatchability of your fertile eggs. So outside the parent stock, most of the broiler chicken, they don't stay for long. Layers that stay in cages, they hardly come in contact with those kind of problems. But parent stock birds have the risk of that dermatitis, which affect their performance as males because they cannot mount the females properly.
Okay. Since the restrictions was there, sir, because majorly we are promoting, injectable drugs. So the use of injectable, as far as poultry is concerned, has some limitations.
Yes.
So that was a major intention to restrict the, Because see, that will be again another topic, that inflammatory drugs, in especially pertaining to the poultry.
Okay.
That would have been another interesting topic to talk on.
Yeah. Hello?
Okay, one more anonymous attendee has asked a question. How can that melusic acid is important for reproductive efficiency? Yeah, Professor, you want to throw
Yes,
some
sir.
light?
Yeah. What's the question?
How melusic acid is important for reproductive efficiency?
Yeah, that is the main work, because if you employ the use of melodin or melodic ash, you minimize the impact of the inflammatory response. And when you minimize it, you don't run the risk of having silent heat. You will be able to detect your animals as soon as they come on heat. Again, when you employ it, you reduce or minimize the inflammatory reactions that follow the reproductive tract for after calving or giving birth.
Yeah.
These are very healthy reproductive assistance which the drug offers. And generally, you see, knowing that any infection elicits some inflammatory reaction, nutrient utilization is very vital for breeding performance. If you don't give the animal adequate nutrients, it will not give you offsprings, at least not the number or the size you want. In pigs, for instance, if you don't use melovin, and they are battling with inflammatory reactions, if they would have given you 12 piglets, it can give you 7 or 8, because the nutrients it would have used to sustain the fetus of 12 piglets have been used to manage the inflammatory response, so that the animal will keep alive. So those diverted nutrients that's why they say the inflammatory is a defensive mechanism, but it's at a cost. And the cost is in terms of nutrients. And these nutrients are what the animal should have used to perform its productive functions, including the reproduction.
Okay, thank you. Certainly, Mr. Anonymous attendee, you have gone through, like you might be practicing. See, certainly reproductive efficiency to improve. There are various traits or various diagnostic factors and the treatmental factors for the reproduction is there. But certainly, when it depends on the reproduction because of the hormonal imbalances, so there might be a few damages to the organs, and that's why they are not able to secrete those hormones, and there is some inflammatory condition. So certainly medoxy cash is an indirect things where we can improve that efficiency, though there is no any direct role. So one question is from Bruce. In Zambia and other neighboring countries where it's hot most part of the year, we could say our livestock are most at risk of they suffer from the heat stress. So directly indicating that they might have subclinical chronic inflammatory processes. Certainly, Bruce, that's very true. They might be having subclinical chronic inflammatory conditions, and that might be one of the reasons for low productivity. Certainly, could this be of poor performance of animals? Certainly, Bruce, as you are also a veterinarian, so you know that because of that, heat stress has a longer impact as far as the poor performance is concerned, whether it is poultry or it is human being also, or it's animals. So they have the ill effect of this thing. So how is general climate, which place climate of a place affecting production in light of heat stress and chronic inflammation. So certainly, Bruce, I guess doctor has already addressed that question. Oh God, there is one more question. Can meloxicam be a treatment of silent heat? Please, certainly meloxicam is not, see, silent heat is another a different topic, a different ball game. So certainly meloxicam, how one can use in silent heat. Please don't coordinate directly with the, this is, we are talking about inflammatory condition. Silent heat is again a different topic. So certainly how meloxicam can be, indicative. See, when professor was mentioning about the reproductive trait and how inflammation is set over there, so that has something different impact. He wanted to have that technical aspect. There is no direct role. Please don't get misguided. Okay. Then there is one more question. Sir, do you know any special medication where people are using especially to combat with the inflammatory condition in poultry? Professor?
Yes, you said
any product or any drug you can say for the poultry? Certainly meloxicam also can be used, but certainly it's as it is injectable, so one has to be very precautious while using it.
yeah. Actually, what poultry producers do is to use multivitamin preparations to minimize the stress conditions. They make effective use of multivitamin preparations. Yes, like your product, which is stress win.
Stress win.
It is, yeah, it helps poultry farmers a lot to minimize the impact of some stresses like heat stress. And even high egg production. Egg laying is a stressful process. So at peaks of production, if you give them some of those multivitamin preparation like stress win, you achieve two things. You keep them at peak production for a longer time, and you achieve higher hen day performance on the long run.
Right. So whenever you are talking about any inflammatory condition, and certainly stress is one of the important factors which may cause the inflammation. So as
Yes.
was saying, especially for the poultry feed supplements, we have a very unique product where the nutrition aspect of stress can be taken care. The product name Stress Wing, it's already there. Any question, please? Can you just put it on question and answer session? Certainly, Mr. Anonymous, we can use meloxicam for the treatment of foot rot in dogs. Any condition, any anti-inflammatory condition, whether it is livestock, large animal, small ruminant, certainly you can use. So whether it is foot rot or anything else, you can use. But in especially for the dogs and cats, you have to be careful.
Even in horses.
Certainly, even in horses, but only for the non-ruminants, you have to take care about, especially the status of kidney as well as the liver, whether it goes with any anti-inflammatory drug. So, especially for the dogs and cats, if they are suffering from any kind of liver disorder or the kidney problem, then you have to be cautious while using any kind of NSAID or any kind of anti-inflammatory drug. Any question, please feel free. Hello, Mr. Birhanu Jimma. Certainly, we notice that you are saying hi to everyone. So, as everyone cannot speak, so on behalf of everyone, I am saying hi to you. Yeah. Chibuze, can you just share the slide?
Hello? You want me to share this? Okay,
Chibuze is sharing the slide. Sir, yesterday I sent you an email. Can you just see that attachment in that email?
Well, you give me some time. Let's go back to that email.
Please, please. Meanwhile, please, participants, feel free to discuss any ambiguity if you have, or you want to get clarified at any point, or if you have any point, to get addressed, you can just put it on question and answer Q&A session. So we will try to address that. Certainly, Sandre, as a molecule, meloving or meloxicam ash both have the same molecule, that is meloxicam. So they can be used in dogs and cats, certainly. We have not mentioned in our literature, but certainly as a practitioner, you can take that call. We just wanted to show you our pack shot. So professor is sharing that on the screen.
Yeah, you.
Okay, sir, professor, you are getting some praise from our colleague from Ethiopia. He is saying that the presentation was very nice.
Yeah, Dr.
Adane.
Dr. Chip. Okay. Thank you.
Professor, you can just go to my mail. First, stop sharing.
I'm going to that mail, but it is taking time.
Okay, you can stop sharing your screen. I've
stopped sharing. I'm
so
going
we
to
can
my
see
mail.
your screen, sir. We can see your screen.
Okay.
Thank you, Dr. Adane, for the praising words. If anyone again has any comments to say, please feel free. We will try to address that query. If you want to have any issues related to the anti-inflammatory and inflammatory conditions, certainly as professor was mentioning, we have option of using of steroids, but we all are professional, so we know that use of inflammatory anti-inflammatory drugs pertaining to the steroid is limited uses because of the ill effects are very high. So the safer side is always preference to the NSAID, and that was why we can recommend meloving as well as the meloxicam ash. Both are the same, which contains meloxicam injection. Okay, there is one more question from Bukar Mustafa. Is there any average age of poultry which will be safe to start administering meloxicam ash? Professor, when we can recommend use of meloxicam ash in poultry? Anything is there like anti-inflammatory when we can recommend in poultry? Professor.
Yeah.
Professor.
Yes, sir.
When we can recommend anti-inflammatory in case of poultry, any specific age?
We have some challenge.
No, can we use? When can we?
No, no.
Hello.
Oh no, you see, in poultry, you're asking whether we can use melovin
or meloxicam ash
in poultry. Is that the question?
Yeah. At what age we can use? At what age?
Hello?
Yeah. At what age we can use this?
He's not hearing me.
What age? Is there any situation you can use it?
use it in both. It's an injector. If you okay.
Just wait, it's coming.
I would like to address everyone's attention to one important fact. See, certainly, if you can evenly Google, you will find that meloxicam is a drug which is very commonly prescribed as a non-steroidal anti-inflammatory drug.
It can be doing that, but it's not such a
That it's a single dose, certainly 5 mg per kg body weight. But let me take that question. Certainly, there is no any specific age. Depends on the condition.
So
If
that
the condition is very grave, you have
free
to
the mail first.
anti-inflammatory.
When we get it, we'll go back to share. You should have stopped sharing at that screen now.
Stop.
stop. What's this difference?
Look at where you stop sharing. Here now. Here. The one below.
No, then nothing is responding. Just check.
Why?
That's what I'm saying. Nothing is responding.
Just stop sharing. Sir. Hope Chibuze, can you see my screen? Dr. Chibuze, can you see my screen? दिसते का हमारी स्क्रीन पर?
नाही ते मी कोणते बोलते मला नाही दिसत. आता ते
दिसते ना? Hope you can see my screen. See, these are the one and the same drug that contains meloxicam or meloxicam in 5 mg. In Nigeria, the brand name is Melovin, and in rest of the countries, the brand name is meloxicam. So, on behalf of Ashish, we'd like to request, please use this unique product, depending on your country, whether it is Melovin or meloxicam, but it's the same, only the name is different. I would like to request you to please use this. Our field colleagues will be visiting you. If they are not able to reach, we are always at your service. Please feel free to write to us so that they can come and help you out where the products are available. And the products are very well available in most of the countries. So feel free. And with this note, I hope now everybody has asked the questions or they have cleared their doubt. But it was very nice and interactive session. Thank you, Professor. Thank you, Professor, for this interactive session and helping us all the professional colleagues from across various geographical locations to understand or to brush up their knowledge more on the inflammatory condition and its impact on the animal productivity. So on behalf of Ashish Life Science, thank you so much, sir. And just we will have a quick, as everybody has given their time, the valuable time to ALS to attend this session. So we have a small, token of appreciation where it will be in form of, certainly the knowledge is the most important gift where we can give it to anybody. But still as a token of appreciation, we have a lucky wheel. so that Smita can coordinate for that. So thank you so much everyone for this one. Just we are at the last thing of the session where we will be choosing 3 different winners who attended the webinar. Over to you, Smita.
Thank you, sir.
Thank you, sir.
They have signed out.
Okay.
Yeah, thank you.
Yeah.
Can you see my screen?
Yeah, we can see your screen. You can start. Yeah.
Can we start? Shall we start?
So we, lucky spin for our winners. This is the list of our winners. So the first lucky winner, we will get it. Mr. Rajab Awani. Soon your gift will reach to you. Thank you so much for attending the webinar, Mr. Rajab.
Okay.
Now let's go with the second winner. Yeah, Faith. Congratulations, and certainly Faith is our colleague from Zimbabwe. Oh, sorry, Faith. No, Faith is from Zimbabwe. Yeah, now let's have the third winner.
Not here now,
Yeah, Mr. Samuel Diallo. Thank you so much, and congratulations to all the 3 winners. Thank you for your active participation, and thank you so much for your time you have spent to listen on the important aspect of anti-inflammatory drugs, especially to our product, Melovin, and also commonly known as Meloxicam. So we patronage your support to ALS, and we will continue this knowledge gaining session. So thank you so much. Have a nice time. So with this note, we will end the session. So thank you so much.
Thank you.
Just a sec. Okay. Wait. So third, we will do it again. So sorry, because since Dr. Faith was our colleague, so we are again for the last winner, we are doing it. Oh, next time, please. So sorry, Dr. Faith, because since you are our internal part, so we are just giving that for our attendees. Yeah, let's go for the. So Samuel will be the third winner. Okay, so this is the third winner. Sorry, now Samuel will become the second winner. Now let's go to the last one. One more time, no problem. Again, it's showing the page, no problem. Yeah, you can just delete from the back end. No, no problem. No, again, Ata is again from our same team. So we are so sorry again, ALS, colleagues, they are only coming. But sorry guys, but we have gathered the knowledge. Okay, now Mr. Oinka Asuzu will be the third winner for this webinar. So thank you so much and congratulations. Soon we will communicate to you how we will be distributing the goodies to you. So thank you so much everyone for your time. And I wish you all the best. Have a nice time. And thank you so much for your time.
And Professor, thank you so much for
Okay, sir.
this event and making this webinar as a successful. So thank you so much. We are looking forward for your association as a long term, sir.
Hello, thank you very much, doctor.
Sir, can you hear me?
I can hear you. I can
Hello?
hear you. I can hear you.
Hello.
I'm
Sir, can
hearing
you hear
you. I'm
me?
here. I'm hearing you.
Sir, I'm saying thank you so much for your time and
Thank
for
you.
guiding us. For
Thank
this
you. It's my
important topic.
pleasure. Thank you.
And looking forward
Thank
for
you.
your long-term association, sir.
Thank you very much.
Thank you so much. Thank
All
you.
right.
Thank you.
Have a nice day.
Thank
Have a
you.
nice day.
Thank you.